evening everyone. Today we are going to have a case study on how virtual reality is useful in medical therapy for the patients called as phobia. So how it is useful and in what way virtual reality is well versed in medical field. So let's have a case study by CSD students. So let's start with the first student.
Good morning everyone. Today we are presenting a case study on virtual reality in mental health therapy, focusing on exposure therapy for treating phobias and PTSD. Exposure therapy is a psychological treatment where patients gradually face their fear in a safe and controlled environment. Traditionally, this was done through image or real life exposure, but now VR technology allows therapists to recreate realistic environment digitally. Using headset like Metaverse, the patient can experience simulations such as heights, flying, or public speaking in a completely controlled visual space. This therapy is safer. This is more flexible and more effective.
Yes, as the student said, the therapy will be more visible and very much clear about how medically all those visible things is happening for the mentally stressed people, okay, who is very much depressed. Those will be they will be giving the views, what and all is needed, everything will be given in the form of therapy, medical therapies through virtual reality.
Hello everyone, my topic is anxiety disorder phobia. Many people suffer from anxiety disorder phobia and post-traumatic stress disorder. For example, someone with fear of height may avoid tall buildings completely. A person with PTSD may relive traumatic event repeatedly. Traditional exposure therapy can be difficult because recreating real-life fear situation is expensive, risky, or something impossible. The patient knowledge virtual if the brain responds emotionally and clearly.
Yes, it's true actually. So as the student said, that's an example. Few will be very afraid of the tall buildings or tall persons like that. In that case, what they will do is they will not be free enough. In that cases, the virtual reality will be more useful where they can open up and they can have some therapies using this virtual reality. So it is one cause for this phobia.
Hello everyone, my topic is how VR exposure therapy works. In VR exposure therapy, the patients wear a VR headset and enters a simulation environment designed by therapists. These environments are developed using platforms like Unity. The therapist controls the intensity of the experience. For example, for fear of heights, the session may begin with a small and gradually move to taller buildings. Sensor track head movements and reactions. The therapist monitors anxiety levels and guides breathing or relaxation techniques. This gradually exposure reduces fear response over time.
So how it is used in virtual reality in the case study is through the engine called as Unity. So with that help, they can able to track the person's eye or the head movements and the body movements. With the help of that, the therapist can able to find out how the person is and they can give the treatment through the virtual reality.
Real case example. One real world example is the work done by therapists which provide VR-based therapy tools for psychologists. They create virtual situations for their fears like flying, small room social anxiety. The patients wear as VR headset and they experience the situation safely. The therapy controls everything and increases the situation safely. After several sections, the patient's fear reduces.
Yes, so some patients will be very much stressed about where they have to go somewhere. But this virtual reality, what the student was telling us, with the help of this virtual reality, they can move on to their favorite work. They can have a communication. They can have a communication with the person, and they can make their stress into. They can reduce the stress. So this is one of the idea given by the therapist.
Benefits and advantages. VR provides a safe and controlled environment where patients can face their fears any real-time danger. It saves time and money since real situations do not need to be arranged. Therapists can easily control the level of difficulty. Patients feel comfortable because they can stop the session anytime. VR therapy helps reduce fear and improve recovery.
Yes, so these are the benefits that can be done through virtual reality. Yes, good.
My topic is conclusion in the school. VR-based expression is a visual treatment. It measures physical and advanced to treat the behaviors as a VR-based standards. It helps to more advanced research in hospitals and etc. In this book, AI-based immersion to remote therapy to make a VR mental treatment of the This is a case study shows technology can boost human well-being, emotionally.
Yes, true. So the students said that there are lots of benefits and the technology has been improved in the medical field for the therapist, for the therapy who is taking the therapy. So in unusual time also, okay, not this patient don't want to go to the hospital. Through virtual reality, the stress can be reduced and whatever the places they want to visit, they can visit and have a stress-free, and also it is cost-friendly. So that's the reason the VR is mainly useful for the therapy people. Okay, so we all understood the case study. Thank you for participating. Thank you.